we don't realize what's going on in the background. This is similar, what I'm going to present is similar discussion of what I did earlier. In the background, how chronic illness is happening younger and younger in society. But most people miss it. And the second question of how million illnesses and million medicines still no solution. This is also a third topic that's happening in the background. Now, through my 14 years of sickness, what happened was, first I got sick and I went for the emergency. I ignored it for some time, went for the emergency. The pneumonia got so bad till I was coughing blood. Then in the emergency was allopathic medicines. So I took all of that, got well for a little while. It had some effect on my digestive system, and then certain digestive disorders came in. So I looked at only one aspect, one stream of healthcare, which was the medical system. And then I had amoebiasis, colitis, still sticking with allopathy. And for about 4, 5, 6 years I was with allopathy, and when the things were not working out well, or when my medication got stronger, I started looking for alternatives. I went to Ayurveda, that was the next. I tried that for 2 years. After that, some success and still finding problems. And then I went for homeopathy. And till that time my colitis was not cured, and it was my homeopathic doctor, very senior guy. He was about 70 at that time, Dr. Hector in Bombay. And he told me, once colitis, forever colitis, you will never get rid of it. It goes into dormancy when you give medications, and when you stop medication, it comes up again. The bacteria or the amoebas, they hide inside the appendix whenever you put harsh medicines in the system. And after you stop the harsh medications, after 15 days, they come out of the appendix and other recesses and corners of the intestine, recolonize your gut. So I tried this homeopathy also for 2 years, didn't work out. Then I was worked upon by some of the best skin specialists, Dr. Louis Fernandez in Bombay, who was the head of the Dermatologists Association of India. So you can consider them at that time the top guy in skin in the country. All that he told me was, I don't know why your allergy is there. I will try to heal you. Maybe it takes 2 days, maybe it takes 2 months. I don't know. And I was taking his tablets, and it went on for like 5-6 years, and I was getting from bad to worse. So this is the saga that I went through. And then in 2000, after 14 years, I came upon one branch of holistic healthcare that set me right, along with acupressure, diet. It set me right in 1 year. The 14 years of sickness got rectified in 1 year. Now, if I had a multidisciplinary approach, where right at the starting there would be a medical diagnosis, where there would be an acupressure therapist, where there would be an energy healer to see what's wrong with my energy, and a psychologist to just see whether I'm under such stress that I was planning suicide, right? So, if I had something like that, probably in 3 to 6 months they would have done a comprehensive diagnosis, and I could have had that healing, in a very short time without going through the saga. So this is what we are saying, this is what needs to be the future. Why do people need to spend 2-3 years trying different things, going through the suffering, through the money expense, even the family goes through trauma, work suffers, business suffers, right? So we are saying, why don't we form something integrated where comprehensive diagnosis is done, and within 3 to a short period of time, you know what is wrong with you and different modalities to heal those things. So this is the main reason why we are talking about integrated healthcare. The second importance of how doctors and healers came together and why it is necessary is, firstly, if there is a Reiki healer, like that one Carl who gave us a talk earlier, and I had fallen sick for some reason, and over 2-3 months of her healing, I got cured. Okay? Then I know I have got cured. I'll write down the testimony, I'll sign it to whoever wants. Okay? Now both of us are trying to give clarity or give other people the understanding that this system works. But if a medical doctor sitting on the other side of the table, right, we can talk to him for the entire day with testimony and all of that. But the medical doctor has also got ethics and certain code of practice. So he's going to first say that, where are the scientific medical tests which show that I was sick in the first place? That's the evidence they need. And so between both of us, the healer and the healing, we don't have any of that information. So that's one good aspect about the medical system. The negative of medical system, like I mentioned just earlier, sometimes they give out treatments, medicines that are not natural, holistic in nature, which cure you completely. They just help you get along for the rest of your life on crutches. So that's one positive of the medical and one negative of the medical side. Now about healers and therapists. Healers and therapists, most of the therapies you will see they have no side effects. They take little time or longer time. Okay? But the documentation, the scientific aspect of it is not there. So for each team to help each other, we have got doctors and healers together. Because even doctors are learning the other special sciences and deeper sciences and getting a holistic understanding of the human body, which is beyond clinical medical science. Right? So that's why there's a synergy for doctors and healers to come together, because they add up both the positive points and they negate both their negative points. So this is an overview that I have given, and I would like every panelist to just give their perspective on what further ideas could be there in this model of integration. Even if you see some lacuna or some fault or some challenge in it getting implemented, I would like to hear about that. Now the first very common resistance we have received is that they say that when a patient goes to an allopathic doctor, the doctor will see them for 10 minutes, he'll charge 300 or 500, and that's one diagnosis done. So it's like, I got some remedy. Now what is the reality of that remedy, whether it's curing or you're going to get worse over the next 2-3 years, we don't know. So normally people are ready to pay about $300 or $500. Now when you say 3-4 people will diagnose you, maybe it can happen at the same time or over different appointments. These people working as a team, maybe at the center or maybe at different places too. Right now, since we don't have a center, I cross-reference clients. They come to me for certain thing, I do my part, then I say, okay, for the energy healing, I would like to refer you to something else. So we work like that as a network too. Now the first thing is that patient will say, so you're going to charge me 300 and he's going to charge me 300 and that lady is going to charge me 400 for this integrated diagnosis. So we look at the cost. We're like, oh, so that means I'm going to pay like 1,500, 2,000. But the point is missed. The point that is missed is that you're getting a comprehensive diagnosis from all angles, which has a very high probability of zeroing on the actual different aspects of your illness and healing it in a much faster way. Right? So that's what we're trying to make people understand, that you will heal faster in a short period of time if it's integrated. Rather than you paying 500 today, then 500 going through suffering for the next, you do get relief from allopathic medicines for 3-6 months, but then after that you end up going for something stronger or for some other recommendation when it's not working. So people invariably are paying 500 today, 500 after 6 months, 500 after another 6 months, 500 after another 3 months. Over 2 years they spend it 2,000, but they've gone through time waste, trial and error, frustration, inconvenience, loss of time. So this is one point that I wanted to share about the cost. Right? So I welcome all panelists to give their take on integrated any other perspective of, in short, if they've heard of some other integrated system anywhere in the world. So we would at least take that reference and say, okay, let us look at that also to improve our model. Yes.
Good afternoon, everyone. What I feel, one challenge that I see is that allopathic doctors usually tend to follow a reductionist model, while natural healers follow more holistic model. You can add a W there, it becomes a holistic model. So I feel that all their advices may conflict each other at some point in time. I feel that a sort of a guideline is necessary to establish a well-established procedure in which both of these can be integrated, or then both of these will conflict and the patient will be in a dilemma as to what to do. Thank you.
Thank you, Rangan.
It's really nice that.
Is the volume too loud?
No, maybe my voice is too loud. So, but more important thing is the people's awareness, that we need to create more and more awareness relating the integrating and alternative therapies. What we have right now, the people's perception is and as Daryl said, they don't have actual time for themselves in finding out the fastest solution for their sickness or their disease what they have. And yes, and most of the things have been spoken by my friends and we've been hearing, so there's nothing much to say. I would pass on the mic to any other one to share.
Okay, friends, I'm a medical doctor, so I'm one of those black sheep that you guys are discussing. And coming from that field, I know how we are trained. We're trained in a set, there are classical textbooks, and we follow it like a Bible. We don't digress, no here, no there. And we look at a patient only in terms of the patient's symptoms. Fever, goli de do. Khasi, cough, give them another syrup for that. So every symptom is given one drug. But that's ridiculous. Because in medicine, there is also another subject which is called preventive and social medicine, in which I did my doctorate. I'm an MD in preventive and social medicine, which talks about holistic health. But it's always looked down upon, saying that all the other systems of medicine don't work. We kind of shun the other systems. But that's not true. We all know it. And for me, I feel right now the work that I'm doing, I'm working with cancer survivors, and I'm using complementary approaches where I'm bringing in the essence of mindfulness meditation. There is sound healing happening, then there is breath work happening. So all of that, and when I approach fellow doctors, they tell me, Evelyn, you do it. You do it. You do what you're doing. We support you. No one wants to come and even see whether it's helping the patient or whether it's helping the clients. They're not worried. They're happy with the chemotherapy and the radiation and the cutting that they're doing. So I feel the way forward is to bring more and more doctors. Therapists are a big lot, but the voice of the therapist is not so loud to bombard the ears of doctors. So we need, like Darren said, very clear evidence-based therapies which will help us move forward. Medicine works on evidence. All the studies that we do. In the morning, Pratiksha presented. She said, I did a study with 10. But again,
body is finally the last in command, where first we get a thought that generates an emotion. Physics 101, we are all energy, that we all know, right? So the body is just a casing. So you get a thought that creates an energy. Energy flows through us. And if that thought is negative, it will create a negative emotion in the body. And if the energy stops flowing because of the negative emotion, the culmination of that emotion comes out into the body as a dis-ease. Finally, that is what illness is about. Cancer, if you read, a lot of people have written about what causes cancer. So we have cancer cells every day in the body which don't metastasize because in some way the energy is flowing and not condensing as cancer in that part, in that organ. So we don't have cancer. But for someone, that part is blocked energy. Now where is that energy coming from? The body has not created it. It has come from the energy not flowing, where the mind and emotion has created it. And like Darryl was saying, like she was saying, a lot of doctors have woken up to the fact that you can't just treat the body, because what is the body? It's like your laptop screen. Whatever is in your database is going to come on that laptop screen, not your neighbor's database, but yours. So you need to go and see what's going on here that is creating a blocked energy that will come out as an illness. Yeah, so for example, say I get, someone calls me and says that, you know, your mother-in-law is coming for dinner and she doesn't like my cooking, for example. So immediately I start worrying that how is dinner going to be like tonight? Okay, so I'll get some advice, I'll get a lecture, whatever is going to happen. By the time my mother-in-law comes for dinner, I actually have migraine. So I'm giving you a silly, normal day-to-day example, but that's the way the body works. So if I am going to treat addiction, diabetes, cancer, without understanding what has caused that blocked energy, it's a very long, uphill and tedious process. But if you can integrate medicine with mental health, it is healthier, faster for everyone concerned, for the survivor especially, who's fighting it. Because if tomorrow I'm going to speak of addiction. So for example, if I'm an addict and I'm going through a 28-day rehab program, if you go through research, if you go through numbers, 40, 60 to 75% of them fall off the wagon after the 28-day rehab program. Why? Because there isn't constant work that is going on with what created the addiction in the first place. I'm very hopeful because I see a lot of change where medical doctors are now attending to the mind and not just the body. And there are a lot of medical doctors who are themselves. There was a doctor who came to me. She was a girl, and you know, she had muscular dystrophy, and her feet, her left foot had just shifted like that. Yeah, the atrophy had set in. And when she came to me, I said, "You're a doctor. What are you doing here?" She said, "Because I know that muscular dystrophy does not have any medical, there's nothing that medicine can do for muscular dystrophy. And I truly believe in the mind-body connection, and I know that this is something that I have created." She was just gorgeous. We worked with her, and her muscular, and I asked her, you know, what is the one thing that causes you pain because of muscular dystrophy that happened to you? She said, when I go to a party and people just look at my feet, because she had to wear shoes, you know, those medical shoes which are like that, like blocks. And she said, I go to a party and people, they don't ask me anything, but they just look at my feet like this and they wonder what's with me. So I said, so what is the objective of this therapy that we are going to do with your mind? She said, you know, I would love to wear normal shoes. And people in 6 months, she came, you know, rang my doorbell, and she was wearing normal shoes. And it is possible because she was doing exercise for her dystrophy, so that the atrophy didn't intensify. back to a point where her mother didn't give her any attention besides when she was ill. So we went right back to the point 2 years old where she had to cling on to her mother's petticoat and keep dragging it because she was not feeling well. So her mind locked into the pattern that I will get attention if I am ill. And look at the devastation that it caused in her body. So the minute she could go back to the source and understand what did she create, she didn't have to create it anymore. Because muscular dystrophy can affect your speech, it can slowly creep up your body, it can be many things medically. But it was arrested, she was great, and she is a medical doctor herself. So I think that we live in times that are absolutely pertinent for the common people to work on this integrated model. And you know, we pay doctors a hell of a lot of money. I think it's time that you empower yourself. And alternative healing teaches you to empower yourself through the tools that it will give you. Thanks.
Okay, hello everyone. I'm Kashmira Elaga, and I'm not a medical doctor. I'm a therapist. I do access consciousness, which is relatively quite new as it's coming into India just since the past few years now. But it's been in US since 1990. Now, at Access also we do have a whole set of body processes where we can, use the energy, as she very rightly said, she and Evelyn also said, that the energy needs to be flowing in the body. So what we do at Access is we just run the parts. Now that I will explain when I have my presentation. But what I want to add on to what Daryl said previously is that I totally agree with what he said. We want to just go for the quick fix and go to a allopathy doctor and just get a medicine for that. But what is going on inside our body, unless and until it comes up again, we just want to suppress it. So that is what is happening right now. And hopefully with these conferences and continued efforts by all of us, things will definitely change for the better for everyone. So yes, I work with the